Welcome back to Julie's Village. I'm glad you're here. In a previous episode, I mentioned the 13 to 14 categories under which a student can qualify for special education services. Today, we're going to take a deeper look into the first of those categories, which is autism spectrum disorder. The information that I am sharing about how a student can qualify for services under this category comes from the Idaho Special Education Manual. Every state can have slightly different criteria, but overall it's pretty similar. In order for a student to qualify for services under this criteria, the first thing that needs to be present is a diagnosis or a determination. A diagnosis would come from a medical professional, somebody who is licensed in everything that they need to be in order to provide this diagnosis. On the flip side, there can also be a determination made in the school setting. Now, most of the time, best practice and what is preferred by school teams is to have this medical diagnosis. But in certain situations, for instance, if a student has qualified under developmental delay and they are coming to that point where a decision needs to be made about what else it could be, they're still showing a need for services. That might be a time when the team might make this determination while in the waiting process for a diagnosis from a medical professional to come. Oftentimes, there is a long waiting list for families to get in to see a medical professional that can provide one of these diagnoses because it's just such a saturated area of medical expertise that is needed, but there are only a handful of providers that can provide this diagnosis. So again, in situations like this, it might be in the best interest of the child for the team to consider this eligibility category even without that diagnosis. However, for a determination to be made, there are a few things that need to be present. The first is that the team needs to include a school psychologist and a speech language pathologist. There needs to be other members as well, but those two have to be part of that determination. What the team needs to consider is if there's evidence that there is some kind of communication or interpersonal socialization delays. These delays typically manifest in early childhood, but they can manifest later in life as social pressures increase or social demands increase. There can be other things that are present as well, such as hyper-focusing or being hyper or hyposensitive to sensory input. You might see repetitive behaviors. All of these things can be present and other things as well. But the social and the communication piece are things that need to be present in order to make this determination. Again, I just want to emphasize that typically it is preferred to have that diagnosis. One of the reasons for this is because outside of school, a school determination does not carry any weight. So if you're looking for outside services to be provided, you will need that diagnosis. So now we look at this against the three prongs of eligibility. Is there a disability? Is there an adverse impact? And is there a need for specially designed instruction? A child might have a diagnosis of autism spectrum disorder and not need a 504 or an IEP. If a child has a diagnosis and there is no evidence that they are not able to be independently successful throughout their school day, there is no need for an IEP or for a 504. If they show that they are doing okay during the school day, but they just need some help in certain areas and all they would need is some accommodations, that would mean that they would qualify for a 504. That means that there is an adverse impact, but it isn't significant enough that they need that specially designed instruction. So this again might be a student who just needs access to some sensory input, but they can access that independently. It might mean that they need some visual schedules or extra prompts when it's time to transition. Those might be the types of things that a student needs just for accommodations, and then they're able to be pretty successful. The next piece is if they need specially designed instruction. It is not uncommon for students with autism, because there is that communication or that social interaction delay, to struggle with taking in the information that's presented, and understanding it correctly, interpreting it correctly. It can also be difficult for them to share what they know in conventional ways. So they might struggle with presentations or with showing their work when they're doing math because they did it all in their head and they don't know how to explain it. These types of things might require that information be presented differently, or that they have different ways that they are able to show what they know. Sometimes, again, this could be an accommodation, but sometimes it might also require that things need to be changed so much that they are receiving specially designed instruction. It is also not uncommon that if they are struggling to correctly take in or interpret the information that's being given, that they will struggle in all academic areas with understanding, again, information as it's being presented. So they might need it presented in a different way to help them be more successful with, again, understanding and receiving that information. They might also need specially designed instruction specifically in that interaction piece. They might need really specific instruction on how to interact with peers and adults. If that is the case, then they would qualify for specially designed instruction. So if all three of those are yes, there is a disability, there is a adverse impact on their education, and there is a need for specially designed instruction, then they would qualify for special education services. Now, sometimes, no matter where students are in that progression, whether they do have the diagnosis, but they don't have a need for, there is no adverse impact at school, and there is no need for specially designed instruction, what happens is that students hold it together all day long at school, and then they get home and they just fall apart because they've put everything they had into keeping it together at school. In this case, a school team can only write an IEP to provide support while students are at school. So if things are going well at school, they won't be able to write an IEP just because they are falling apart once they get home. However, it is okay for you to ask for suggestions and recommendations. Oftentimes, school teams have worked with lots of children who have needed ways to help them make big transitions throughout the school day, and they have quite a resource of ideas for things to help students with those big transitions, with decompressing and preparing for the next part of their day. So it is okay, again, to communicate with the school team that, hey, I'm noticing that when they come home from school, they're falling apart. I'm getting good reports from school, but I would like to know if you have any ideas on how I can help them once they get home. Again, this wouldn't be a formalized plan, but they can certainly share ideas with you. We'll also address this in future episodes. I will share some ideas, and hopefully we'll hear from parents as well who have seen similar things. One thing to keep in mind is that this is very difficult to experience that day after day. But also, it does show that your student has the skill of recognizing that public is different than home, which is an important skill. So if they are able to hold it together all day during the school day, you can anticipate that in other public places, they will probably also hold it together pretty well, which again is a great skill. It doesn't take away the fact that it's very hard again once they get home, and supporting that is important. But it should, I hope, I hope that you will take that as a compliment to you and your parenting if they are doing well at school. I hope that this was helpful. If you have ideas or recommendations for things that you would like to see in future episodes, I invite you to leave that in comments. If this information was helpful to you and you feel like it would be helpful to others, I invite you to like, share, subscribe so that this message can become more visible to other viewers. Thank you so much. Have a good one, and we'll see you next time.